Good afternoon. I am Dr. Annette Ticoras. I'm hoping not to trip on that cord. I welcome all of you this afternoon. This is part of the Plain Talk series. Today we'll be talking about how best to work with your physician, talk to your physician, communicate with them when you have a new diagnosis or perhaps even a chronic diagnosis. Maybe a new treatment has been proposed, or multiple treatments that you need to decipher what you'd like to do, and how really to best communicate with your physician in making that happen. Does that sound like a good topic? Yeah. Okay, wonderful. I was hoping to show a video, but I understand that it will be linked to this this particular talk, so it's something you can go back in and look at. It's actually one that was produced by the government using your tax dollars. I think it's fantastic. It has several patients as well as physicians themselves talking about how they manage those appointments with their own physicians. And I think the beautiful thing about showing that first is because everybody can identify. Perhaps you come in here and you're able to ask questions or feel comfortable with your physician. Maybe you then are sent to a specialist who is new to you, or your physician retires, or you go in and your physician doesn't see you, but you're seeing a nurse practitioner. So even those who found a comfortable space with their own physician find themselves often in a scenario where you're going to have to communicate with someone you haven't before. And that's not comfortable for everyone. And that's especially not comfortable for people, I would say, in the 60 and up group. That group has grown up with their physician and those in the healthcare field. What they say goes. What they suggest or recommend is what I should do, and I really don't question that. And then behind them comes their adult children who say, well, why didn't you ask? Why didn't you question? What are the other alternatives? Why would you not ask what this medication is for? So often when I give a talk similar to this, I'm giving it to seniors, which is, I think, who we're targeting here, or those who work with seniors. And so I think it's really important to understand that you're going to have to either, one, empower yourself to ask these things, or you're going to have to recruit someone on your behalf to come alongside to do these things, whether it be a family member, a neighbor, a grown child, or, in my case, I'm a patient advocate, so people hire me to come and do that on their behalf. The thing I always like recommending to people, and I will kind of do this as though this is an appointment, perhaps an outpatient appointment or a specialty appointment, but I think this would also translate right into a hospitalization. How do you prepare for that encounter with the healthcare system? So number one, it might be a doctor. It might be a whole team of doctors if you're in the hospital and they're all going to round. And some have short jackets, some have long jackets. Some are in scrubs, some are there to clean the room, and you think that they're your physician. So it's very, very difficult to determine who that is who steps into your room and stands at the foot of your bed. Number one, I guess, ask. Who are you? What is your role in my care, and make certain that you know who you're speaking to. If this is an outpatient appointment, I encourage people to come prepared. I have a lot of clients who are past executives, or a lot of them appear to, tend to be engineers, teachers, nurses, and I said, or even in the community, have you ever gone to a meeting and not been prepared, or prepared an agenda, or thought about what you wanted to say, or how you're going to utilize that time? And I think it's a shame that people don't appreciate that and take that same mentality to an appointment. You're going to have a set amount of time with the physician, and it keeps getting shorter and shorter and shorter. I've read averages as small as 7 to 8 minutes of face time, most of which is going to be spent with the doctor's eyes up over a screen. So if you come in and just think, we'll just wing it and see how it goes, but I do have a couple things I want to cover, I'll have them here in my mind. I can't tell you the number of times that someone will come out and say, oh shoot, I forgot to ask the very thing that I came here for. We all get a little anxious, we all get a little nervous. A lot of physicians or healthcare providers will kind of take the lead, and you just kind of come along for the ride. So if you do not come prepared with the things that you want to cover, and you want to make certain that you walk out of that appointment with, chances are pretty great that they won't be addressed. So, number one, put down 5 questions. I think that this is essential. This is your agenda. If you were going to the grocery store, you could wander back and forth through all the aisles if you've got that kind of time and find what you want and stumble upon what you really needed. In this case, again, time is of the essence, so write them down. What are new issues you have? What are old issues that you remember? If you start doing this in a pattern, you'll have your list from your last appointment, and you'll remember, oh yeah, we said we were tabling that till the next appointment, so I want to bring it up this time. We also decided that I was going to give some feedback on how things went from last time to this time. I need to bring that up. Again, the onus should be on your healthcare provider, but I'll say it again and again and again, the empowerment, if you really want it to be different, it's going to come down to you or the party that you've brought with you to make certain that these things are covered. They need to be in order of importance. You may have 5 or 6 things. Start with the most important. If you put 5 things down, I guarantee you're probably not going to get past 3. If you do, please let me know who your physician is, because I've got about 30 people who'd like one like that. So prioritize. If things get moving quickly, then that's great. You've got 5, but anticipate 3. Any concerns that you have, anything that has changed, any new symptoms that you're having, any concerns with medications, you name it, put it down, and keep kind of a tally going from one appointment to the other. I also know many people think, oh, I've got that little kink in my knee. This is about the 3rd month I've had it intermittently. I want to remember to address that. But on the day that you go to the appointment, it hasn't bothered you for 3 days, so you probably don't think of it. So keep a running tally of things between appointments that you feel may be necessary or something that you might want to address. I also think it's important to realize that not everything is going to be handled in that room, the room with the table and the paper and the gowns. It may be handled by the front desk. It may be handled by a nurse on the way in or the way out. It may be handled by a brochure. It may be handled by a video that you're asked to watch. It may be handled by sending you to another care provider. So a lot of people want everything to be addressed by the physician, the nurse practitioner, whoever that provider was in the room, and they're very reluctant to take any direction or any education from anyone else. And I'm here to say not always is the physician the very best person to be giving that additional information. So if by chance you're somebody who's a new diabetic, and now there's going to need to be some diabetic education, you do not want your physician giving you diabetic education. I guarantee you it will be subpar. It will not be helpful. So when they say to you, I think that you're a borderline diabetic, you need some more information to be given to you, I'd like you to meet with one of our nurses, set another appointment up, or I need you to step out into this other room and she'll meet with you. I think people need to understand that it very much has turned into a team approach. So be okay if your physician says to you, I feel you need to work with somebody else on a particular item, or that question that you brought will be addressed by someone else. Number 2, this sounds ridiculous, but bring a pencil and a paper. People come to these appointments and there's a lot of information exchanged. You're supposed to have your list of 5 questions. You're now going to be given answers to your concerns. And if you don't have anything and you're not writing it down and you actually think that you're going to remember that after you leave and get home and get asked 3 times by other, loving family members, you won't. And I don't care what age you are. Again, research shows that we don't hear things appropriately and accurately when we're under duress, and I don't know of anything that's more under duress than being in a physician's office in a paper gown with the breeze in the back and somebody standing there with their hand on the door, and you've got a list of things you want to cover. And the words are coming out quickly, and they're words that you've not heard before, and you don't know how to spell them, and you're not going to be able to Google them later if you don't even know what they were. So it's very important, and this is not something you're writing on the back of a coupon or in the back ledger of your checkbook. You should have a clean sheet of paper or flip over the one that you brought with your questions and be prepared. And don't be afraid to say, whatever that medication you said was that you think I might need, could you spell that for me? This is the time to ask. Don't wait and hold them all till the end, because if you wait till they stop talking, your 7 minutes will be up and you won't have any of this information that's so pertinent to your health. Write all the answers to the questions, any new issues that come up during the appointment, things that were said that you didn't understand, things that you want to have covered in more detail, so that when hopefully you come full circle at the end and you hear is there anything else we need to talk about today? You've kept a tally and you've got a ledger there of things, and you're not scrambling at the last minute, or you're not, heaven forbid, asking the nurse to go get the doctor and bring them back in. That's not going to happen. And then people become very offended. Well, why wouldn't they? Your time is while they're there. Once that door opens and closes again, they're on to the next person. And again, I think bringing these notes or keeping a binder, and we'll talk about that a little bit, but keeping a binder where you're keeping a running tally of this was a problem, these were the questions, these were some of the solutions, and it's resolved. And keeping a running list of how your care is provided to you and being able to reference back to it. 3, an extra pair of ears. I alluded to that, and it can't be stressed enough. I've worked with clients who have come out of an appointment. I've not been there, but they've called me and they've said, we just saw the oncologist, and one spouse says, I've got 6 months. There's really nothing that they can do here. I'm looking at 6 months, and then it'll be hospice or something downhill from there. And then I talked to the spouse who also sat in the room, who said, no, that's not what they said at all. They said, we're going to continue to monitor you for 6 months. We have 3 or 4 different treatment plans in place, and we will institute one of those in 6 months. To me, those aren't even in the ballpark. But when you hear the word cancer, or you hear the word heart disease, or you've had a heart attack, or we've found something somewhere, the ability to focus on those things kind of goes out the window. So men, I'm sorry, and most of you right here in the front are men, do not want somebody going with them to their appointments. I don't know how else I can say it, but get over it. Find somebody. They don't want to bring a friend. They don't want to bring their golf partner. They don't want, they don't want to bring their wife, because that's just one more thing she's going to know about, that she's going to nag about, and she's going to keep saying, the doctor said, remember. So I don't know how to tell you best to facilitate that, but we're all the same. And that's the beauty of the video I want to show, that I hope you'll go and watch, is there's a physician on there, and she makes it so clear how she's misunderstood her own information, and she herself follows all of these same rules when she goes to, and I do as well. So extra ears of your choosing, because you need more people. Maybe one person's just the scribe. Maybe they don't understand the first thing about what's being discussed that day. That's fine, as long as they're writing everything down for you. For a while there, and it's kind of fallen a little bit out of favor, people were recording their appointments. If you have no other option and you really don't want somebody else there, that's an option. I always encourage people to let the physician know. This is not one of these where you turn the recorder on your phone inside your purse and then you just carry on. I wouldn't suggest that. I would say, just like we've said, I'm here alone. I don't have another option. I feel it's really important that I not only hear you and be able to focus on our conversation, but I be able to go back and review what we've discussed here today. Do you mind if I record it for my own personal use so that I'm certain I don't miss anything? Number 4, bag of pills. And this, I mean all the pills. I know we all think we know what we take, and we know the doses of things that we take, but when you're, again, there in the paper gown, it's amazing how quickly the names start to run together, and the dose that you used to take becomes what you think is the dose you're taking now. There is a wealth of knowledge on a prescription label, and physicians, they can trust the label. You can trust the label. It has your name, has when it was filled, has when it was last filled, has how many refills are on there, has the exact medication, not the way you pronounce it, but the way that it's spelled. It has the dosage that you're taking. It has how many, if you calculate how many should be in that bottle. And I can't tell you how many times you open up a bottle and it has twice the number of pills that should be left if it was filled on this date and they started to take it at that time. There's a problem, and you can get to the problem if you've got all of the information there. So I encourage people to throw all of their bottles in a bag, Ziploc bag, and off you go. That way you're not wasting time in the appointment going, the little purple triangular one. Well, the physician doesn't know what the little purple triangular, he doesn't know where you filled it or what generic brand you have. And I've sat with a PDR and looked up people's pills because it was that important, but that was all we did for the whole, that took up all of our time. So if you've got it right there, it'll save time. Over-the-counter medications are important for physicians to know about, and people don't think they count. Tylenol, Motrin, all of those are metabolized in such a way that they can interfere with other medications you're taking. They need to know about it. They need to know what doses of them you're taking. I've even learned just recently, I was not aware that fish oil had such a strong and powerful reaction in the body, and it thins the blood. So a lot of people take fish oil. It's wonderful. It's great for your cardiovascular system. But if somebody is going for a elective or emergent procedure that will involve bleeding, to be on fish oil will prolong your bleeding time. So people don't think to bring some of these things up. Sometimes you can be taking too much of a vitamin or a mineral, and that's what's causing the problem. So be forthright about all of them. Herbal remedies, the same. I have clients who are immune suppressed. You have to be very careful with herbal remedies. They can contain contaminants and things that will actually cause an infection or additional issues and problems. So be honest and forthright about everything and throw it in the bag. I also, I use my mother as an example. My mother doesn't seem to be able to tolerate any medications. Hope she's not going to watch this. So everything she ever takes, it made my stomach feel funny. It gave me a headache. I felt weak in the legs. And so she'll stop taking them. And then, it'll come back around 3-4 years later. Somebody else will recommend prescribing that same thing. And she will have forgotten. She's already been there, done that, decided she didn't want to. So I'm not saying to bring those medications unless there's been a real problem, but at least keep a list of medications that you were prescribed and that you stopped for whatever reason. I stopped it because it did help my blood pressure, and now I've lost 20 pounds, so I don't need that blood pressure medication, but it's great to know in case you ever need it again. That one worked really well for you and you tolerated it well. Or this is something I took and I had a terrible rash, or it made me cough, or I broke, whatever it be. I think it's important, just as important, you know what you've taken before, why you stopped it, and what any reaction was if you had it. Dietary changes are also something that's important. A lot of people are, again, using supplements and smoothie enhancers, and all of those contain a lot of ingredients that can sometimes cause people problems. So if you've changed your diet, you've cut something out, you've added something in, you're eating something in great amounts, I think it's important to at least be mindful of that. Also, with regards to medications, and this will be more towards the hospitalized, but each time you go for an outpatient appointment, they always are trying to give the medical list, and there's a couple caveats here. Number one, I know you'd like to roll your eyes and not go through that list one more time, but it's so essential that you try and update it. But what I've figured out over the last couple of years is, in addition to telling them the changes, in most of the healthcare systems here, unless a physician okays those changes. If they're just given to the nurse but it's not executed, those changes don't stick. So that's why each time you go back and you're like, I told them the last time and the time before and the time before that, I haven't taken that for 3 years. And then every time you go, it's repopulated in your list. It actually needs to have a medical provider okay that this is now taken off the list, or this is added to the list, or this is an allergy. So all of these things, again, are very important to keep them as updated as you can. The healthcare systems are getting a little bit better about communicating with each other. So, encourage them. If you're usually in the Ohio State system and you happen to be at Ohio Health, say, will you check my Ohio State records, my chart, and make sure that you pull that list up, and let's go over that list and review that list. So do yourself a favor, keep it up to date. Allergies, I can't stress enough. You know what you're allergic to. There may be circumstances where you're not able to speak on your own behalf in emergency situations. So I would make this very clear to whomever your designated person is in case of emergency call, that they know that the last time you were given penicillin, you had a rash, you had difficulty breathing, you were sent to the ER. Not only what you're allergic to, but what happened when you took that. I had a client just recently who had a severe anesthesia reaction, and they're aging solo, so they don't have anyone else, and I will be the person who's called, and that is highlighted, underscored, all over the chart. If I ever am called, that is very, very, very important to know about that individual. So these allergies are important. Do not trust that it's in your record. Do not trust because it is on your armband when you're in the hospital. There are all these safeguards to this happening. But if you have to look at it, remind yourself, oh yeah, it's all the sulfa drugs, and they come in and she's got something in a cup, or he, the nurse. What is it that you're giving me? Do you know these are my allergies? Is there any chance that what's in that cup is something that I would have a reaction to? And once you've cleared that, then you're good to go. But I can't I can't underscore that enough. Know your allergies. Make certain the people around you know your allergies as well. Not just drugs, food allergies. If you have nuts, wheat, dairy, all of those are really important. They may be playing a role in what is going on. They certainly will be playing a role if you receive any of those. A lot of medications contain dairy and wheat. If you're not mindful of that, you could be given things that you're allergic to. If you have seasonal allergies, it's important for people to know. If you have latex allergies, I've been seeing more and more that's a specific one that's asked for. That's obviously very important if you're in a more acute care setting like a hospital. Another thing that I believe needs to be very clearly delineated to yourself, to your caregivers, and to those people around you who are going to help assist or guide you or come alongside is who your healthcare team consists of. Who is it who's controlling your blood pressure? Is it primary care? Is it the cardiologist? Is it the pulmonologist? And we've come into a lot of problems when you have multiple, too many cooks in the kitchen kind of thing. So I like clients and patients to write down all of the physicians whose care they are currently under, all the medications that particular physician prescribes, and all of the conditions that you see that one for. So for example, somebody may have COPD or emphysema or asthma, and you think that they would have that their pulmonologist would handle that. If they don't have a pulmonologist, that may be being handled by their internist. Or if they have an internist who's chosen to defer that all to the pulmonologist, then they kind of don't touch those medications. But all of them need to know that each of them are writing for what they're writing for, so that we don't have interactions. And that's usually where I consider or try and encourage people. I know we're all trying to get the best deal on our prescriptions, but if you can get them all filled at the same facility so that they're aware when you drop off the pulmonary or the endocrinologist, and they mix that in with the things that you're already taking from primary care, that you're very, very careful to know that there are no drug-drug interactions there. And when you're seeing a physician and you know that they're your physician for everything pulmonary, then just stick to that. I need you for my inhalers and maybe my emergency dose pack of steroids. So try and let each person do what it is they're doing, but allow them or help enhance their communication amongst each other. Another thing that is very important in the hospital as well as out is really, again, keeping some kind of chronological diary of your health. And I know that somehow this speaks to, I can't believe that I'm old enough that I have to keep track of these things. We all do. And the earlier I think you start, the better off it is. Keeping it in a binder, accumulating things from one visit to the next, having sleeves where you're putting pamphlets and things you've been given. something that you could hand over to somebody in the case of emergency that has the last time you had your blood work checked. Maybe you're on vacation, or maybe you're in a new healthcare system that doesn't have access to your records. If you've got what your standard labs were last fall when I had my physical and I had all of these things done, I cannot tell you how far that goes to preventing all of that from being duplicated for sore throat and a fever in the emergency room. I mean, if there's no reason to be thinking about these things over here, they won't be done if you're able to provide those. It also helps when your doctor is going over something new. Okay, now we're going over this year's labs. They might not compare them to last year, but you may want to. And, hey, your cholesterol is X, Y, or Z. And you'll flip it back and you'll say, well, that's actually up a bit from last year. Again, this is the physician's or nurse's practitioner's job, but hey, that's up a little bit. When should I start to be concerned about this level that I have? And again, if you're not keeping some records of your own, that you're kind of being mindful of the trends that things are taking. Another thing that people fail to bring to their appointments that is very important, and oftentimes a physician will ask someone to do a blood sugar diary or a sleep diary or a blood pressure diary, and I think a lot of people think this is just busy work. It's not at all. And if you take it into your physician and they kind of dismiss you, then I'd be a little concerned about why are we not paying attention. There's a lot of value to those diaries. So they're not supposed to be busy work. They're supposed to be a really helpful way of seeing what has transpired from your last visit to now. So if you've been asked to do one, obviously don't leave it at home on the counter because it's not going to do any good. The conversation kind of goes like this. I ask you to track your blood sugars. Do you have that diary for me? Oh, no, I don't have it, but they're pretty good. You've just wasted that whole section of where that could be dealt with because this is your second visit now about maybe being a diabetic, or maybe if you lost the weight that you're not a diabetic and that nothing more is needed other than to continue the weight loss and the exercise. So bring those along with you. Don't fail to make them a part of your visit. Blood pressures are always, I know everybody knows that your blood pressure usually goes up at the doctor's office if you're somebody who gets a little anxious by that. So that, again, that's a wonderful way of showing your physician between visits, I'm perfectly fine. It's just when I get in here and your staff and you and the coat and the whole thing, the blood pressure goes up. And if you can show that you're not, you've just kept yourself off of a medication. You're doing yourself some good. Sleep log diaries are important. A lot of people as we age have difficulty sleeping, and it is not a natural part of aging. So if somebody's telling you that, that's just not true. Sleeping less is a natural part of aging, but waking up frequently or having a difficult time falling asleep, none of that is normal and can be addressed. So if you've been asked to keep a sleep log diary, keep a sleep log diary. There's a lot of helpful information there. Symptom diary, my hip's been bothering me. Well, how and when and where and what were you doing and how long did it last and what did you do about it and did it get better? I think a lot of people think, well, I will remember that when I get there, but if that was a month ago, the questions are going to be pretty specific. Do you really need an x-ray, or do you just need to take Motrin on the days that you garden? You're not going to know if you don't have some accurate information to provide. Again, the expandable file. I know everything is electronic. Again, I usually speak to an older crowd, many who don't have access to the internet, or if they do, it's in a library, and I would never encourage them to be accessing their health portal from the library. I wouldn't encourage them to access anything private like that from the library. So in that case where they don't have the access and they don't feel comfortable electronically knowing that most of their information is available there. As a caveat, it's not all there, but a lot of it's there. I really do encourage that expandable file. There's just, it's a great resource, and it's a great way to go back and reference where you've been and where you're going. If you're able to pull out a lab that another specialist is saying, I need to do this, and you're able to say, well, no, I just did that 3 months ago for this doctor or that doctor. if you can hand it right over, or they're like, oh, we haven't done an EKG in 2 years, and you're like, no, I just had one done. I was in urgent care, and well, I don't see it here. So anything that you can do to avoid the duplicity in the system is a wonderful way to go. The next one is more of just I don't know what you call it, just how to best get along. It's kind of the squeaky wheel gets the grease. Well, sort of, but there's the other saying about honey and bees and whatever. The biggest concern that I hear from patients and clients over and over again is I have a hard time. I struggle with the staff in the physician's office. The staff turns over. I feel like I'm just a number, and then I get in the room and I feel like I'm even more of a number. And I go in there and I sit and I wait for 2 hours, and then I get 2 minutes, and nothing is feeling good about the system anymore. So there again are a couple of things that I encourage people to do. Number one, acknowledge that the person that you first encounter when you come into an outpatient office, maybe not the hospital, but an outpatient office, has more power, wields more power than you will ever imagine. So the person who does this sort of thing and slides the window open and pushes the clipboard out to you, that's where you're going to choose if you're the squeaky wheel, or you're going to be sweet and agreeable, at least at the onset. So treat that person with respect. They're the ones who are setting the pace for the entire office. They're the ones who are saying who goes next and who goes to the back of the line and who gets rescheduled and who doesn't, and it's a shame, but that's how it goes. So number one, I think people sort of disregard or disrespect that first person. Number two, most, again, especially my older clients, always arrive early, or at the very least on time for their appointment, and they always follow the instructions. If you're supposed to be there 20 minutes ahead, they're 20 minutes ahead. So I always encourage them to make a point of letting that individual know that they've done what they've been asked to do. Hi, I'm Mrs. Jones. I have a 2 o'clock appointment. I was asked to arrive at 1:40. It's 1:35. How is the doctor running? Is the doctor on time? Is the doctor running late? When do you expect that I might be seen? Am I still going to expect the 2 p.m. Appointment time? The reason I encourage people to ask that up front, because if it's already a 2 hour, 1.5 hour, 30-minute, I think you have a right to know. I think you have a right to make peace with that if that's what you're going to do. It's a whole lot easier to do when you know that and you have the option of rescheduling or of sitting quietly, but you've also kind of put the staff on notice. I was here on time. I expect to be seen on time because that's what you told me. We're running on time. And so if I'm running late, then that might be where you're going to need to have a little bit more of a discussion. But it's so much easier to have if you've set the tone when you first get there about needing to be on time. Maybe you don't have anything for the rest of the day and it doesn't bother you. That's perfectly fine. But if you have other things going on, I think that's a really important thing to get out in the open when you first get there. The very last, I don't know where I'm doing for time. The very last thing, and this is something I always bring up, is just at the end of the day, I try and empower people in all avenues of healthcare, whether you're at the lab, just having your routine blood drawn, you're in the hospital, feeling very vulnerable in a bed, or seeing a physician for the first time. However you can empower yourself. If you're somebody who, the more I know, the more comfortable I feel, Google carefully. Use things like Medscape or WebMD or something reputable. Mayo Clinic, Cleveland Clinic, Ohio State. If you're going to look for an article or you're going to look for a summary of a medication or a side effect or a disease process that they're tossing out there as a possibility for you, be smart about where you educate yourself. Take notes if that makes you feel better. But if that helps you be more calm and feel more empowered, then by all means, empower yourself with knowledge. If you're somebody who says, I don't want to know anything, I think it's important that you express that to your physician. Listen, I know a lot of people these days want to know everything. I don't want to know everything. When you get down to the choices I need to make, will you explain them carefully to me so we can make that decision together? So however you feel most empowered, whether it's staying quiet and letting your grown child speak on your behalf because you've cleared it all ahead of time. Hey, you're going to do the talking. Here's what I'm worried about. Here's what I want to know. And here's what I don't want to have happen. If you've kind of given that responsibility to another person, that's wonderful. You've still empowered yourself because you now have someone who's going to speak on your behalf. I think people, more than anything, need to remember that the appointment or the hospitalization or whatever experience they're having within the healthcare arena is all about you. It's all about you. None of this would be happening if it weren't for you, the patient or the client. So although it may feel as though you're the last thing that anyone while you're there, I think it's very important to kind of hold your head up and think, if I wasn't here for this appointment, none of these people would be engaged. So the entire staff is there working towards the patients and the clients who are coming in to be seen. So take comfort in knowing that you have every right to be there. You have every right to feel comfortable and satisfied with Steve. And if not, try again. And if all else fails, it's a continuing thing that's happening again and again, I always recommend maybe it's time to find someone else. So if decided to, starting 2020, I'm going to make certain that the relationship with my healthcare team is a bit different and that I'm a bit more involved and I don't feel like a passive role in all of this. You may choose to say to your physician, hey, I know I've been seeing you for 7-8 years now, but as I age, there are a few more issues each time I come in, and I want to play an active role in that, and I just don't feel like I've had the opportunity to do that. So I'm going to try, and would you please respect me in that and help me? I'd like to try and have a more involved role in my healthcare moving forward because it's important to me. If that's scoffed at or that is not well received, at least you know that now. So the option then is for you to, try again with someone else, or at least again you've empowered yourself into finding a situation that works better for you. And I saw it happen yesterday. I mean, someone really trying to empower themselves, and it was not well received. And that person will be hard pressed to go back there again. This thing, the monitor, I don't know that that's going to go away anytime soon. But there are still physicians that wheel themselves around from the screen and at least start face-to-face, eye-to-eye, get some initial things out of the way, and then slide back around and do what they need to do. And I think that people need to understand if they don't do it there, and then there is no other time in their day to do that. So again, with all the paperwork, that's their allotment. In those 7 minutes, they have to do paperwork, see you, examine you, treat you, decide on a care plan, and then execute it all in that short period of time. So the screens aren't going away, I'm really sorry to say. But find somebody who it works with you, how you handle that screen time and that face-to-face time. I normally, we do questions throughout the whole thing, but I guess we'll just do them here at the end if there are any.
Why not give the doctor an index card as the 5 questions? Why is that not good?
Oh, I think that's a wonderful idea. So the question was, when I go to a doctor's appointment, if I've got 5 questions written down, shouldn't I just give it to the doctor? Again, couple of thoughts there. I've watched that list disappear, so make sure it's not your only one, whether it's conveniently or accidentally. When you finally get to the list, what list? I don't know what list you're talking about, and that was the only list you had. So I have a couple copies of it. I suggest actually giving it to whoever checks you in and say, I'm seeing Dr. Jones today. These are 5 things I'm going to want to cover. Do you think he'd like to see this in advance of coming in? And yes, most of them would like to see it in advance of coming in. So yes, I think that's an excellent idea. If you've got those written down, get them in the hands of not the receptionist at the front, but when you start to get more to the back where it's an MA or a nurse or the doctor himself, yes, I think they should have their own list to follow along. And I bet it becomes part of your chart as well. Excellent. Anybody else?
You find the doctors you were talking about, I guess in the care team, do
you find doctors do a good job of communicating between them, or is that
The question was, when you have multiple doctors, do we feel as though communication is adequate between them? Obviously, as with anything, some are better than others. So there are some that are painstakingly make sure they're communicating well to others, whether it's through the electronic chart or through a letter that's written to the office. I always encourage my clients, again, to push for that to happen. So when you're leaving and they've said, well, I'm not going to do this, that, or the other thing because that's for your cardiologist, I always encourage them to say, so you'll send something to cardiology and let them know that they're supposed to pick this up from here, or you'll send that test that we just did so that they're aware of that as well. So again, but you have to have a sense of what would be appropriate for them to be communicating to underscore that. I find that that's a role that I play a lot. I think 90% of what I'm doing sometimes is just improving the communication, because it's all the information is out there. And when I say out there, it's, up in the cloud, but you have got to have a reason to pull it down and look at it and be interested in looking that patient up before you're ever going to get that information in front of you. So I do think more or improved communication is vital as we move forward. The question is, how hard is it to find a new doctor, and do you have to stay in the same practice? So obviously you can do whatever you want to do. Then the next step down is, well, do I want my insurance to pay for it? Because if you do, then you have to go with the providers that your insurance covers. And then I would always caution you that I have read time and time and time again that the list that you're given and the portal for your insurance is not as accurate as it should be. So I always encourage people, you can go on there. It's a wonderful place to start. Let's say you have Blue Cross Blue Shield. Go to their portal, plug in your information so that you know who would be available to you with your specific plan. But then when you've selected someone based on ratings and stars and their picture and their education, or however you choose someone, then I always tell people, you got to go one more step. You got to call the office and talk to the billing, not to the front office, to the billing. I would like to be a new patient of Dr. Brown. I see he accepts Blue Cross Blue Shield Gold, or whatever your specific one is. Is he one, taking new patients? 2, would he accept my insurance? And 3, any other additional questions you have about what hospitals that's becoming less a question. What hospital does my doctor go to? Because your doctor rarely is the one to see you when you're in the hospital. You're almost always covered by a hospitalist team. But, they may tend to be in a certain healthcare system. So maybe you only want to be in Ohio State, but you pick someone who all of the people they refer to and their specialists and the people they're very comfortable with are all a Mount Carmel system. So it still has some bearing. So you might want to say, what hospitals are they usually in conjunction with? And then I think you can still do kind of a meet and greet with a physician where you sit down and you just get a feel for, does this feel right to me? And if it doesn't, you're not locked in there. You can move on to another. I don't think you're ever locked in. The trouble always is when you have them do your annual exam, you're not going to get another annual exam for a full year. I don't know if that's answered your question. I think it really has to come down to how do you feel? Number one, what are your needs? How do you feel about the person when you meet them? For some people, they don't want to drive more than 5 minutes from their home. Others are like, I don't care how far I need to drive. I want it to be an internist who's trained at such and such. I also have a lot of people who say it's very important to them the age of their primary care. They don't want to age out of their primary care's practice. So if you pick somebody who's in their 60s, 70s, they're probably going to retire or at least be semi-retired in the next 5 or so years. So if you know that your health, given your health, I plan on being here another 20 or 30, you're going to be needing to pick one out of necessity. As far as whether they're in your practice or not, if you've had an opportunity to kind of try a couple of them on for size, like Dr. Brown wasn't there, and instead you saw his partner and you liked them, if the reason you're changing is because Dr. Brown's no longer available, they will usually do those lateral changes. If you want to do a lateral change within an office because you didn't quite get along, sometimes that can be a little bit trickier. Sometimes they ask both doctors for permission for you to move to the other one before they will allow that to happen. Did that answer your question? Okay. It's not, but there are plenty of physicians out there, and I also know that the whether they're accepting new patients or not, that's not accurate either on most of the internet sites. It'll say, no longer accepting patients, and you'll call and they're like, oh yeah, why would you say that? Because that's what it says. So, yep.
As a follow-up to that, though, is there a way, either with everybody wanting to look up something on the internet, is there a way to look for a doctor before you go and visit them? Is there a website, or if not, how would you recommend somebody finding a doctor?
Again, I have them always start with their insurance because most people, that's important. You do want it to be paid. You want them to be in network. I search the same way everybody else does until I have a good feel about enough of them. And about the time you get a good feel about enough of the good ones, they're not accepting new patients anymore. But everybody has a rating system, and you have to treat that the same way you would the Chinese buffet down the street. When you read through them, you have to get a consensus of what people are saying and why they're saying it. And when you start to see the same thing over and over and over again, then I think you've got to give that some attention. I have had clients who've had difficulty with physicians who perhaps were underskilled and or being sent somewhere that they would look up that had a star rating that wasn't too impressive. And you can go to the Ohio Medical Board and see if there have been any actions or lawsuits or complaints filed against them. It's also the same place you go to file a complaint. I do want to mention, though, I went to a conference recently, and a physician was speaking, and he was talking about a colleague of his who had stopped practice, and not her primary reason, but I think one of the final reasons that she did was because of the quote-unquote star rating system. And in her particular practice, she practiced with other individuals who readily would give those medications that are otherwise not easily prescribed. So the Xanax and some of the pain medications and the things that everyone has been so cautioned not to just be giving so liberally. Many of the other people in her office and other physicians in their immediate area had no qualms about doing that. She did. She only wanted to prescribe them when they were necessary, and she could justify it, and she could, and so those individuals would then go and do the star rating for her, and just basically she watched as all of these epidemics have increased, that her star rating just kept going down because she was trying to practice good medicine. So in that case, we just lost a really good physician who was really doing things the right way, but the star system and the rating system worked against her. So, when you start seeing 200 and 300 ratings, I think there's some weight to those. When you see there's 5 ratings, same as the pizza shop, and there's a 1 star and 4 or 5 stars, you got to really wonder, was the 1 star legit? I don't know. There's only 5 people that are talking about it. So use it sparingly, and then trust your own judgment, and ask other people. If you can find somebody who has a primary care who's accepting new patients, I would talk to them, because that's somebody who really knows how not only the physician is, but how the office works. You can have a great physician, and you can have some of the nastiest staff in the world, and you can have some of the most wonderful staff, and you just really feel as though you're well supported and everything goes fine until the door goes closed. So in talking to somebody who's actually been in the system, I think that's really good, and that's helpful, especially if it's someone whose opinion you respect. You had something?
These days, it seems like, when you're going to a specialist like an orthopedic
So the question was, for example, when you're going to see a specialist, but you get there and you realize you're not actually seeing the specialist, that you're seeing a paramedical, so you're seeing a nurse practitioner, a PA. I think those would be the only two providers that you would see, but you're not actually seeing the orthopedist who you thought you were seeing or the pulmonologist you thought you were seeing. One of my tips would be to back it up already to when the appointment was made. So I even recently went to see someone, and so my question was, will I be seen? And then I was told, well, actually, is that something you want? And I said, well, I don't know. When would that be scheduled? Well, that was going to be like 5 months from now. What are the other options? You can see a PA who specifically does this, 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 and this, which happened to be exactly what I was going for and could be seen later that week. And I said, I'm willing to try that on for size, because right now I think that's a good place to start. It gets me in the door. It gets me a couple things to try or do. And then if I feel like I need to, and in that particular case I said, well, I still, as a physician, still a little concerned about not seeing. And they said, you know what? He or she is here at the same time. And if there are any questions at all, the nurse practitioner or the PA has access to them, because a lot of them have to work under them. As a team approach, they will have access to them for any additional questions or concerns that you might have that you feel has gone beyond the scope of that individual. So I guess the answer would be, if you're really needing to see the physician, make sure that's who your appointment's with before you go. Open your mind to, again, possibly those other providers may be a good first step for you and may get you in sooner and may get you the help and the therapies you need quicker. And if that's not working, the standard or the first line for you, then you were naturally going to be pushed along to the physician ultimately in the end, but you're already in the system. Did that answer that? Okay. Anything else?
You referenced the video earlier. Where can that be?
I'm going to give the link to Julie to put on the website. It's just I think it's maybe 5 minutes, 6 at the most. And then there are some pre-printed lists of where you can put your concerns that you want to have addressed, whether you're in the hospital, and when that team starts rolling around and, making certain you've got the right questions for the right team. And there's also a brochure that was published again by a governmental agency that talks a little bit about making the most out of appointments. If there's no other questions, have a good afternoon. Thank you.